Dr. Sugar Semi, a dentist and PhD in maxillofacial surgery and fellow in head and neck oncology. It is my pleasure to talk about the Hans Biomed. It's one of the best and also FDA approved actually thread in the whole the United States, North of America, and it's my pleasure to join as a faculty with them. First of all, maybe you will ask, okay, this is PDO. We know that we have lots of like PDOs in the whole United States and all over the world, in Middle East. But the thing is that the difference is, first of all, it's so similar to a company that I don't want to say, but it's so similar to the cones, and it was already, you can see the barbs is molding. It means that when you just want to cut or when you have a skin retraction, is not going to, first of all, not going to traumatize the skin, and second, is not going to be fall down like easily, and also your lifting is not going to be like very short term. And second, also, maybe some of the healthcare practitioners said, okay, we don't want to go for any kind of PCLA because it gives you fibrosis and long lasting. That is actually one of the sometimes maybe good thing or bad thing, can be a win-win situations, because actually is going to be absorbed in maybe next 6 to 8 months. But we have in 90 days, we have collagen type 1, and also we have fibrosis that gives you the lifting. Mostly of, for the Hans, the means actually, the patients can redo it in each maybe year, once a year. And we have different types of the thread. My favorite one is actually like the Mint Easy, and also there's another one, 43, that is like something, this is actually 42 centigrade, it's just like bi-directional and it's double needle. And it's really good for the lifting, especially if you have sagging in prejoint area, is one of the best. Mostly my technique is insertion is on the temporal fascia, and you should know about the danger zone. In next video, I'm going to talk about a little bit much more about the danger zone. And the good thing is they have different types because they have some sort of like fine, tip, fixed, mini, and petite. I'm just going to talk about right now the petite. First of all, the petite is, this one is actually, is bi-directional and is like somehow between like, roughly around like 5 centimeters, and it's give you it's very good, especially for nasolabial fold, like and also if you have some sort of like patient with neurotoxins, they are not going to have a smooth, just like aesthetic lines, and you can see you can use it for the forehead. We have another one, the fixed mini is actually, it will mention the fixed because sometimes you're using lots of like double needles or threads like from the blah blah blah. I don't want to say that is like there's no any financial disclosure, but the good things is that it has some kind of like fixations. It means that giving you better like suspension augmentation at the same time, and it gives you really like reversal fixation, because we are going to have maybe with the Mint Easy or 43, you're going to have a lift, but with the fix, you're going to have better fixation and much more long lasting in the lifting effect. We have another one that actually regarding of fine, that again is bi-directional, is W cannula also, but it's like a 2-0, and it's really good for the patient that they have some sort of very thin skin and they are very prone to bleeding. That's actually minimize the bleeding with the fine one. We have another one actually that means the tip one, that mostly we just use it in case of like nasolabial folds, or sometimes maybe they have a minor sagging or just not too much sagging in a prejoint area. And also this is very like delicate and it's really very easy. Me myself, I use it like a couple of years ago. There is no any sort of, I haven't seen any kind of complications or pops, nothing. The most important thing about the threads, especially with the Mint, the good thing is that FDA approved, they have lots of clinical studies, and the second thing is that they just somehow, I haven't seen complications. And if you just check the articles and lots of like, manuscripts that are already published in different high impact factor journals, I didn't see any kind of complications. Looking forward for all your healthcare practitioners to have Mint in your office. And if you have any questions, just send us an email or just text us, or just like email to us, and definitely one of us will just going to answer you. Thank you so much for listening to us.